My name is Mary Ruffin Williams, and this is my presentation on the steps to treating depression. Depression is defined as a common but serious mood disorder that negatively determines how we think, feel, and behave, the leading cause of disability worldwide. When treating depression, it is important to understand the symptoms a patient has. Depression is a common mental disorder, but the number one cause of disability in the world. There are symptoms to major depressive disorder that affects day-to-day life. Symptoms include sadness, hopelessness, emptiness, loss of interest, trouble concentrating, anger, frustration, anxiety, pain, obsession, guilt, feelings of worthlessness, self-hate. Sometimes people form drug habits to try to even out the chemical imbalance and self-harm. There are many causes of depression. There is still research into what levels of changes in the brain can lead to depression. Suppressed memories from traumatic experiences, changes in the level of neurotransmitters located in the synapses, changes in nerve cells, nerve connections, and the functioning of nerve circuits are all connected to depression. When neurotransmitter levels are too high or too low, depression can be induced by those neurotransmitters sending the wrong messages to the brain, so miscommunications in the brain. The main three neurotransmitters involved in depression: norepinephrine, serotonin, and dopamine. First, norepinephrine is located in the sympathetic nervous system. It sends the fight or flight signal through different cells in the brain. It controls how the brain processes fear. It is also involved in constricting blood vessels and raising blood pressure. Serotonin helps regulate moods, and it tells the body when to eat, and also sends signals to reduce pain and regulate anxiety. Serotonin is mostly found in the digestive system of the body. It also sends messages about how we feel emotionally. Dopamine activates the brain's reward center. It is known as the feel-good hormone and transmitter. It is connected to the pleasure center of our brain, fine motor functions, and memory. Sometimes, because dopamine is found in the reward center of a brain, it encourages the person to repeat behavior. So if you get pleasure for something and you find yourself repeating it, it's normally the dopamine that the brain releases. Other neurotransmitters involved in depression or found to play a role is glutamate and GABA. Glutamate plays a role in learning and memory also. It encourages curiosity and pushes one to learn new things. GABA decreases the level of activity in the central nervous system by blocking specific signals. GABA helps the brain to deal with fear, stress, and anxiety. It produces calming effects in the body. This is done because it prevents and blocks chemical messages and decreases the stimulation of nerve cells in the brain. Causes of chemical imbalances in the brain could be the lack of a specific neurotransmitter or receptor sites that are blocked, and neurons can cause miscommunications in the brain. Too much of a neurotransmitter can also cause malfunctions in the brain. So when there's too much or too little of a neurotransmitter, there are miscommunications being produced in the brain. And these miscommunications can lead to depression. There are many different treatments that have been used to treat depression. They are often performed in a certain order. So with psychotherapy, it is the first course of action to treating depression. Psychotherapy consists of therapies that involve individuals, groups, couples, and sometimes families. The types of psychotherapies are interpersonal therapy, psychodynamic, dialectical, behavioral therapy, psychoanalysis, and supportive therapies. These therapies are meant to help a person through depression without introducing medications. Once it is found that once it is found that psychotherapy alone is not helpful, medications are introduced. Medications can sometimes treat moderate to severe depression. Along with psychotherapy, there are 4 main types of medications to treat major depressive disorder. SSRIs, because of low levels of serotonin, that can be linked to depression. These drugs prevent the reuptake of serotonin in the brain. Normally the first line of care when medicine is introduced into the treatment of depression. These drugs have been shown to have fewer side effects. These drugs are drugs like Celexa, Prozac, Zoloft, Paxil. Next, we have SNRIs. They work by inhibiting serotonin and norepinephrine being reuptaked in the brain. This class of drugs prevents the reuptake of serotonin and norepinephrine in the brain. People with liver problems and high blood pressure should avoid them unless the doctor feels that the benefits outweigh the risk. Some of these drugs are Cymbalta, Savella, Fedzima, Effexor, Prestique. Next are MAOIs. They are probably one of the least used drugs to treat depression because these MAOIs can have extreme side effects when a person has a coexisting disorder or sickness. What happens is that MAOIs prevent the brain from breaking down dopamine, serotonin, and norepinephrine. These drugs can have interactions with other drugs a person may be taking. It is often one of the last used in medicinal care. Then we have atypical antidepressants. These affect how the body produces dopamine and norepinephrine, and those are drugs like Wellbutrin and Trazodone. Ketamine has also become a drug used in the treatment of depression because ketamine reduces depressive symptoms quickly. One of the most controversial treatments for depression is electroconvulsive therapy. The treatment causes localized seizures in the brain with the hopes of reducing depression symptoms. It is said that 70 to 90% of people have success rates after this treatment. However, many consider this treatment to be inhumane, outdated, and politically incorrect. Things that need to be considered when treating depression are the age of the patient, the severity of the depression, comorbidity. Does the patient have other conditions that exist with the depressive disorder. Consider that the goal of treating depression is remission. How the neurotransmitters need to be balanced in order to create a normal state so that moods will be stabilized. Evidence data suggests that the longer it takes to go into remission, the greater the risk of treatment resistance. So the longer it takes for a person to be treated in the right way and figure out the treatment that works for them, the longer it takes for them to go into remission and stay there. Tricyclic antidepressants block a neurotransmitter receptors, including muscarinic, adrenergic, histaminic, and serotonin receptors, and thus have many effects on patients. Some are beneficial and some are adverse. So using certain depression treatments, we have to be sure that those things work for the patient and not harm the patient. Major depressive disorder results from a complex interaction of social, psychological, and biological factors. So when treating depression, we have to consider all things that goes on in a patient. So it could be things that go on in the brain, such as the chemical imbalance. It could be something social that's going on around them, like bullying. And then it could be something, that's going on at home. So it's important to consider all things when treating depression. It is the essential components of collaborative management of depression include identification of patient-defined problems. So what is the patient saying is going on? Targeting, goal setting, and planning, making sure that we come up with a plan that works for the patient to give them ease in life. A creation of a continuum of self-management, training, and support services, making sure that the patient feels supported and that their goal plan is actually working for them, and then active and sustained follow-up. So it is important that we check in to make sure that whatever medications are prescribed for the patient is working and that the patients are feeling more balanced and not less balanced. The thing about treating depression is that because so many different things could lead to it, it's important to kind of test out treatments by trial and error to make sure that what is being provided to the patient is going to help and not harm them now and in the long run. It is also important to consider that most antidepressant treatments take 6 to 8 weeks to fully show evidence of going into remission from depression. That is my presentation for the steps to treating depression.